Both South Korea and the U.S. reported their first case of COVID-19 on the same day, January 20th.
If you look at what South Korea did and what we did, their population is 1/6 of ours. Look at the cases they have. Look at the mortality they have. It's a trifle compared to what we're dealing with right now.
A country like South Korea seem to be coming out of this thing after 2 months. Something they're doing is working. So we should be doing that. Well, we aren't.
With the rising number of deaths and confirmed cases of the novel coronavirus here in South Korea, the country has raised the alert to the highest level. At a government meeting, President Moon Jae-in called for a stronger response system and cautioned against taking part in group events.
South Korea has raised its COVID-19 alert level to serious, following a sharp hike in the number of new cases over the past few days. That's the highest level in the country's 4-tier system. During a Pan Ministry meeting on Sunday, President Moon Jae-in called for a strong and unprecedented response to contain the virus.
Current global circumstances suggest it's likely that this virus will cause a pandemic. Now, it's not so much a question of if this will happen anymore, but rather more a question of exactly when.
There's concerns over the coronavirus outbreak, and once again, they are affecting the stock market. Look at that right there. Wall Street ending one of the worst weeks of trading since the financial crisis in 2008.
So far, 34 coronavirus cases have been confirmed in the U.S.
Been a steady stream of people coming to the Las Vegas Convention Center, and we're getting our first good look now that the sun is up at hundreds of people.
It's going to disappear. One day it's like a miracle. It will disappear. Nobody really knows. The fact is, the greatest experts, I've spoken to them all, nobody really knows.
Now the Democrats are politicizing the coronavirus. You know that, right? Coronavirus.
The one bucking the trend has been South Korea. It avoided a spike by doing one thing better than others.
South Korea is testing 15,000 people a day. We haven't even tested 15,000 people so far in America across the whole last 2 months. It pains me to say this, but it really was an unmitigated disaster, what the Trump administration has done.
The diagnosis system in South Korea was so advanced that people were just being tested more. Is that because it's free, South Koreans have very easy access to one of the testing centers, and they could even drive through if they so wish, and they would be notified within 5 to 6 hours of testing with about 98% of accuracy.
I came here this morning, I was in the emergency room seeing patients. I still do not have a rapid diagnostic test available.
Hard to manufacture?
It is easy to do for some countries. What happened in the United States is that the CDC created a test,
up a reagent,
sent a test out to 50 states, and then said, oh, hold up, don't use it. let us fix it.
How quickly
it's
can
now
we get on
March.
track now?
We hear that it's coming very soon, but I'm here to tell you right now, at one of the busiest hospitals in the country, I don't have it at my fingertips. I still have to call the Department of Health. I still have to make my case plead to test people. This is not good.
In both the US and in places like South Korea, they're using pretty much the same system, a thing called polymerase chain reaction, which is a really common technology that basically any laboratory that does any work with genetics is going to have on hand. So the problem is not a technology problem. The problem is a logistics problem and a supply problem.
When it comes to coronavirus testing in Florida and across the nation, it is a waiting game and sometimes too long. Testing sites can't seem to keep up with the influx of people.
Healthcare workers told him he'd get a call with results in 3 to 5 days.
It's now been 8 days, 9 days. I haven't heard a word from anyone.
But South Korea then did something the U.S. has not. Implemented a system to electronically track people and the disease. Here's an example of how it works. Let's say you find out you have coronavirus. The government then uses your cell phone and credit card data to track where you've been and then blast out an alert to the cell phones of people who may have crossed your path. Our own Jui Cho showing us what one of those alerts looks like on her phone.
The South Korean government has ordered manufacturers to supply masks to state-run or public retailers from early as this afternoon. Manufacturers are required to release at least 50% of their daily output, or 5 million face masks, to retailers. And to prevent hoarding, each buyer will be limited to 5 masks. An additional 500,000 masks will be supplied to medical facilities and the Daegu Medical Association.
With masks in short supply, they're encouraging people to make cloth masks at home.
And all over the country, there's a run on masks and protective equipment.
As hospitals stock up on supplies, their suppliers across the country are running out of protective equipment.
Governors desperate for supplies have complained of price gouging.
This is an N95 mask. This is it. It was 70 cents before this started. It's now as high as $7.
The president said he would use the Defense Production Act to force 3M, one of the world's largest mask producers, to prioritize production, a move some critics say is too late.